Business engagement in health is quite important as health becomes more significant on the global agenda, whether it's H1N1, HIV/AIDS, or the new challenge of non-communicable diseases. I think business has to be engaged to improve worker productivity, meet corporate social responsibility ambitions and policies, and also make the world a better place. Well, at the Pan American Health Organization, we define our forward agenda based on protecting some of the gains that we already have in the region, such as immunization for eliminating things like polio and measles, addressing an unfinished agenda, problems like neglected tropical diseases, malaria, and facing new challenges, such as non-communicable diseases, injuries, violence, mental health problems. That's the broad framing. We look at the burden, we look at cost, we look at what can be done to solve the problem, and then we make proposals to our governing bodies, which is the Ministers of Health of the Hemisphere. They meet every September, and they're the ones who set the policy for the organization. During the judging process, I think I enjoyed it. All the projects are great. They're making good contributions. Some are really innovative and have tremendous potential. Especially those that are systemic, those that dealt with building surveillance or research capacity. One thing that stood out was the challenge that exists with monitoring and evaluation and showing impact. And I think there's scope there for greater partnership with government or organizations like my own that have a lot of capacity and metrics about what's going on in populations. Some people, such as variability in what folks wrote down, no unpleasant ones. Lessons learned, I think, in terms of, and the projects were of two kinds. There were some that were, looked at 6. 4 were looking at specific problems, and 2 were systemic, building capacity for research and for surveillance. And they're qualitatively 2 different kinds of things to judge. So those are some reflections. Tackling non-communicable diseases in the Americas is a top priority for the Pan American Health Organization because of the huge burden. It's the #1 killer, and it's the #1 cause of avoidable cost for member states, and it's increasing. On the other hand, there are a lot of solutions. Those solutions do, however, require folks to work together. Government can't solve the problem alone. We need civil society. We need business at the table. Entry points for business include workplace wellness, which will have a more productive and competitive workforce, CSR programs, and then working with government and civil society to create the conditions for a healthier population and create more demand for healthier products and services. The Pan American Health Organization has established a Pan American Forum for Action on NCDs. Companies can certainly join that. We have a lot of companies that are already at the table and looking at how to tackle specific problems. Dietary salt reduction, for example, tobacco control, scaling up access to cardiovascular care, workplace wellness, cervical cancer. Those are some of the priority areas. Even if companies don't join the forum, I think other entities like GBCHealth is a great entry point for working on NCDs. As the world, people and policymakers wake up to just how serious a problem we have with this issue. Together, we can tackle a lot of the problems that are facing us. And in fact, we need to, because alone, I work my own as our governments, there is a clear realization among the member states that government can't solve many of the problems alone, like mental health or NCDs or injuries. We need to work with others. But there is also still some nervousness about that and learning of how to do that.